Okay. First of all, we have to thank everybody for joining us here today. It is an extremely bright day in the city of Fall River as we are now taking a huge step forward in our goal to better the lives of our residents combating substance abuse disorders. We're going to celebrate today that Fall River was awarded a 2021 FRCARA grant by SAMHSA. It's $2 million over the next 5 years. This grant will provide us in funding that will be used for substance abuse and behavioral health in the city of Fall River. We had a ton of partners help us with this grant. It's a tremendous step forward. I know I'm going to leave some people out. Representing STAR is Patricia Emslem. She's going to talk in a minute. The Boston Medical Center is being represented by Jamie Shorten. Compassionate Healthcare, Robin Dupree. River to Recovery, joining us is Kevin Doyle. Recover Fall River, Essentia Wellness, and of course it's a partnership with our local communities. Fall River, Somerset, Westport, all those fire departments have worked hard to get this, help us get this grant through to help the entire region. What this means for us going forward is that we'll be able to provide Narcan, training in substance abuse, Narcan use, and behavioral health for our police, our EMS, and community groups, and additional boots on the ground in this battle. It is also going to allow us to invest more support in recovery coaches that can be used throughout these communities to assist their residents. I do have to thank a couple other people in-house. Our grant writer, Jane DiBiasio, did a lot of great work on this. Obviously, with any grant this size, there was fits and starts. Mike Dion from Community Development was right there from the first time we rolled this out. And these people all contribute for one reason only, to make Fall River and our surrounding neighbors a better place to live for everybody as we fight this opioid addiction, mental health scramble that we're in right now. With that being said, I'm going to introduce a couple of speakers. But needless to say, we are very pleased that Fall River and the surrounding communities were accepted to receive this grant. From our police force, I want to introduce a good friend of mine, Jeff Cardoza.
Thank you. Good morning. I'll keep my remarks very brief. Anybody that knows me and knows me fairly well knows that drug addiction has impacted my family. I've lost 3 immediate family members to drug overdoses, so this is very important to me. And one thing that I've learned over my 31 years of law enforcement, and specifically this last year of being chief, is that getting the word out and getting those type of drug addiction workers, the certified recovery coaches out, works. I'm going to introduce Nikki to you guys, and I've watched what Nikki's done with our homeless folks and those in need. So she's doing a fantastic job, and by us getting this funding and the surrounding communities getting this funding, we're going to be able to make a significant impact, I believe, on those that are struggling with this addiction every day, these addiction issues every day. So, Nikki, please.
Thanks, Chief. Thank you. My name is Nikki Fontaine, and I am the homeless substance use advocate for Fall River, but more importantly, I'm in recovery. It's easy for myself and others like me to tell you that we had a problem and we're in recovery now. It's not so easy to tell people that we have an active drug addiction and we need help. But it's even harder yet to tell you that I was molested growing up and I suffered with severe PTSD in silence for decades, which drove my addiction. But we have to shatter the stigma of mental illness and substance use. We have to realize that the majority of people using are struggling with an underlying mental health issue and that both need to be addressed and treated simultaneously. This grant is a huge victory for Fall River, Swansea, Somerset, and Westport. Small towns are famous for suffering in silence, just as I did growing up in Dayton. It's a known fact that people living in these towns are coming to Fall River to get their drugs, but they also come here to seek recovery. This grant will now give us the ability to work together to save lives and break down that invisible barrier of a town line. 5 years ago, when I co-created our volunteer post-overdose program called Project Reconnect with many of the people standing behind me, we knew we needed to get city officials and the police on board with us to make a difference. That program without a single cent, has connected hundreds of individuals to services and treatment, and I have no doubt that with this funding, we will touch thousands of lives over the course of the next 4 years. We can't afford to wait until someone finds the motivation to seek help. We need to bring the help directly to their doorstep, to the tent cities, and do it with understanding and compassion. It's no secret that detoxes and shelters are so overrun and understaffed right now, so having a BMC clinician in the police station alongside coaches from STAR and River to Recovery will give us the ability to clear patients who suffer with co-occurring disorders, bypass emergency rooms, and streamline all types of treatment across the board. 8 years ago, I was a homeless heroin addict in this city. I couldn't stay sober for one day. But people believed in me when I couldn't believe in myself. We will be that hope on each call we go out to, and no one will be turned away or treated as if they are less than. This grant includes Narcan and sensitivity training for first responders, and it also gives the city the ability to distribute desperately needed Narcan. Together, we're going to make a difference. The people standing here today got involved because they truly care about those who struggle with mental health and addiction. They answer their phones all hours, on weekends, on holidays, and I just want to thank them for partnering with the city. And thank this administration for believing in this program. Also thanks to Rep. Fiola and Senator Rodrigues and Linda Pereira for the support. We're ready to save lives. Thank you.
That was moving. Next, from STAR, we have our COO, Patricia Emsalem.
Thank you, Mr. Mayor, and thank you, Nikki. Great job. Good morning. STAR's CEO, Nancy Paul, is out of town and regrets that she can't be here. She worked with Nikki and with Jane DiBiasio and others to develop the proposal, and she was thrilled to learn of the award. Like many of the collaborating organizations, those of us working at STAR witnessed firsthand the need for this program. The rate at which we lost to overdose, the patients we've known for years in recovery and relapse, feels like it dramatically increased during COVID. The City 911 reports 23 fatal overdoses in Fall River in the first 4 months of 2021. I imagine at least one of those people or their family members are known to every one of us here. STAR's role in this collaboration includes community and family education, as well as improved access to treatment post-overdose. STAR's addiction medicine physician will help develop and implement training programs for first responders, civic organizations, and work sites such as manufacturing plants and distribution centers. Our family support workers and ARISE family intervention staff will offer education and support to families, and our mobile health van that serves the Hispanic Latinx community will provide education and outreach to those residents. A key element in this initiative is improved access to treatment. When someone survives an overdose, that is a uniquely teachable moment for the individual and those who love them. STAR wants to be able to offer help with a full range of treatment options at that moment when the person and family are most receptive to change. In addition to the full range of treatment currently available, inpatient, outpatient medications like Vivitrol, Suboxone, Methadone, we have received federal certified community behavioral health clinic funds to open a post-overdose monitoring and observation unit. This will be a resource for first responders who can bring people post-overdose who aren't ready to commit to inpatient treatment but need a safe place to be comfortable and medically monitored while they learn about treatment options and talk to recovery coaches. This unit is expected to open in the late fall. It can accommodate up to 6 people at a time and will allow for greater safety post-overdose, as well as reduce the burden on our local hospital emergency departments. Thanks to the mayor for his leadership and to all the organizations that are participating in this important collaboration. Fall River may have some high degree of social problems like addiction, but this city can be proud of its resilience and the unusual degree of collaboration and commitment to addressing these issues that's demonstrated by the success of this bid.
And I do want to acknowledge a couple more of our partners that are here today. Caitlin Rowley from Senator Roderick's office and Sophia Mayetta from Carol Fiola's office, one of our state representatives also here, which we will be working with the council to make sure we get this grant approved, is Linda Pereira. And our partners from Somerset, Todd Costa, Swansea, Mark Hamzon, and Glenn Nunes from Westport. Our last speaker is someone that's going to come down and really provide us with the services we need to keep this battle going. Jamie Shorten from the Boston Medical Center.
Thank you, everyone. Thank you for having us here. My name is Jamie Shorten. I'm the Assistant Director of Emergency Services with Boston Medical Center. About 4.5 years ago, Boston Medical Center was awarded the contract for emergency services for the city of Fall River and the surrounding teams. The surrounding towns. We have a team dedicated 24/7 to responding to mental health crises, which includes substance use. At that time, we started to forge some pretty wonderful relationships with the providers here behind me, the hospitals in the area, and other stakeholders. With this grant, it really allows us to take that another step forward. We're now going to be adding a clinician with this dedicated team who can provide the mental health and behavioral health support for the individuals who are struggling with substance use. As we know, substance use does not come without its mental health concerns. We want to be able to partner with our constituents to be able to provide very necessary access to the system that this population might otherwise encounter multiple barriers for. So with that, we are very excited for this grant, for this partnership to continue and strengthen. Thank you very much.
Okay, that concludes a great day in the city of Fall River. We'll move forward to get the grant awarded, and we'll go down to the council to see if they approve it. And I know that we can do a lot of great things in the city of Fall River with this money and the team behind us that are going to carry the ball across the goal line. So any questions for anyone today?
Okay. I just want to know, Mayor, what's the timeline in terms of, obviously the departments have always talked to one another, police departments and the other communities, but in terms of implementing this within the structure of what we want to accomplish here, is there like a date certain that, people will start actively seeing these services being provided?
Right.
And the officers will be able to, take that into what's happening out on the street?
I'm going to turn that over to Nikki. She's our point person on that.
So the implementation of this is actually over 4 years. I know that's 5 was said, but it's 4 years, $500,000 each year, and the deadline. We're going to begin meeting with our partners in the next 2 weeks to begin planning and implementation. And I believe that it is by December that this will be up and running. Correct, Jane? What? Yeah. Yes. By December, up and running with all the partners. So by the fiscal 2022, you will see it in full swing. First responders being trained. I believe we had a number of 250 that will be trained the first year. And it grows each year. So we're looking forward to it. We can get you specific details if you'd like. You're welcome.
Okay, thanks, everybody. Thank you.